Jane Fry-Bowers, and I'm at the WIN conference. And my poster is Factors Associated with Satisfaction with Care Among Low-Income Patients. And we looked at the level of satisfaction with care among low-income patients receiving care at a county hospital. And it was important for us to look at satisfaction with care because the literature indicates that when patients aren't satisfied with their care, they're much less likely to follow through with provider recommendations, adhere to medical regimes, continue to see their practitioner when they need to return for care, leading to fragmentation of care and eventually poor patient outcomes. So we looked at a specific sample of participants from a larger study looking at heart failure. And we examined their satisfaction with care using the Patient Satisfaction Questionnaire, which was designed originally by the RAND Corporation. And it looks at several dimensions of care, including general satisfaction, technical quality, interpersonal manner, communication, financial aspects, time spent with the physician, and accessibility and convenience. And what we found, and we also looked at acculturation levels too, because a lot of our participants were Latino, and so we wanted to see whether or not their level of acculturation also impacted their perceptions of satisfaction. Satisfaction is based upon whether or not your expectations are met, so we wanted to see if there were different expectations based on cultural background. And what we found was that a lot of the subscales, the various dimensions within the patient satisfaction scale, were interrelated, they were correlated. So it really demonstrates that these factors are very difficult to tease apart, that it's hard to say how much time spent with the physician contributes to patient satisfaction compared with accessibility and convenience, compared with the physician's interpersonal manner or the provider's interpersonal manner. And so it's sort of all interrelated, which has significant implications for any interventions. Then we also found that when looking separately at the Latino population, we found significant differences between Latino and non-Latino patients from a standpoint of their satisfaction with the technical quality with the care and also the communication. And the communication piece was not unexpected to us. If you have sort of cultural influences that may impact the way you're able to communicate with the provider, particularly if there's not language concordance, it certainly can impact your level of satisfaction with the communication. But the one that was a surprise was the technical quality. And we need to explore why is it that the Latino patients felt that they were getting a lower quality care. And then we looked at insurance status and whether that made a difference. And come to find out, insurance status has a huge role in whether or not an individual is satisfied with their care, with those who do not have any sort of insurance feeling very unsatisfied with care. So overall, what we found is that low-income patients are at risk for significant differences in patient satisfaction, levels of patient satisfaction, meaning that they are not satisfied with their care on several different dimensions. This is important because it has implications for whether or not they're going to return to their provider, whether or not they're going to adhere to the recommendations made by their provider, their medical regimes, and so forth. So it has really significant implications for overall patient outcomes. Also, it's going to impact how we intervene with our patients. So if we know that they're dissatisfied with communication processes, then what can we do as providers to improve those processes so that our patients will have better outcomes?